This is the Whole Care Network. Helping you tell your story one podcast at a time. Content presented in the following podcast is for information purposes only. Views and opinions expressed in this podcast are solely those of the host and guest and may not represent the views and opinions of the Whole Care Network. Always consult with your physician for any medical advice, and always consult with your attorney for any legal advice. And thank you for listening to the Whole Care Network.
Welcome to Island Treasures, a place for caregivers to hear encouragement from other caregivers who, by sharing their experiences, offer helpful information and resources for your caregiving journey. This podcast is brought to you by Alongside Caregiver Consulting, and I am your host and caregiving consultant, Alison Van Schie, from beautiful Vancouver Island in British Columbia, Canada. Today's podcast episode is a continuation of a wonderful conversation I had 2 years ago with Toni Gitles. In the episode entitled, "And Then I Danced," Toni is a certified caregiving consultant, educator, facilitator, specialist, author, and gifted speaker. Her services and resources stem from her own search for resources when she was caregiving for 14 years for her mother. Toni now provides many resources and is involved in numerous projects that benefit caregivers and their care recipients. She has written a new book called The 21 Mistakes Caregivers Make and How to Avoid Them, which provides solutions and strategies to reduce stress and increase happiness. So let's hear more directly from Toni. Join me now as I welcome Toni Gitles back to the podcast. Welcome, Toni Gitles. It is a pleasure to have you back as a return guest on the Island Treasures podcast for caregivers.
Thank you. It's just such a pleasure to be here, Alison. Your work is shining a light for caregivers all over Canada and the US and maybe other places.
Well, thanks, Toni. And I think yours is too. And so let's do a brief recap of your caregiving journey that got you to the place where you're at now. So take it away.
All right. Thank you. Well, I did take care of my mother, and how it started was a phone call. We were living in different places. I was in San Francisco area. Mom was in Orlando. And she said, "The doctor isn't helping me. I have pain." And he said, "There's nothing he can do." And I said, "Well, doctors don't say that. Let me come home and let's go to the doctor together." And my background is in healthcare, and I was an instructor at Baylor College of Medicine. And I thought, well, I got this handled. So she made an appointment. I flew home, and lo and behold, the doctor said the same thing to me. "Your mother is old. What do you expect me to do for her? There's nothing I can do." Nothing. And I asked my probing questions, and I got no result. No referral to a pain specialist or someone else, a gerontologist, and no resources at all. So we left pretty shaken up, actually, because what to do next, because she was in having a serious health issue. So we eventually did resolve that. We found a pain clinic, but it was a wake-up call for me. I had been away from home for a number of years, working and going to changing jobs, going across the country. And I was far away now. I was in California. That was way too far. And Mom was 86 at the time. So that is a wake-up call. And I'm not saying 86 is old, but you got to start thinking about possibilities for the future. And really, a health issue, a crisis is in that category. So I did fly home, and we did get her issue resolved, but I didn't think that I was going to become a caregiver. I was just her daughter, and we were going to go on this journey together, and I was going to solve all her problems. But I did solve the first one. We found a pain clinic. We got her taken care of. So that's how everything got started. And Alison, it turned out to be a 14-year journey, which was totally beyond anything I expected. And, you take it a day at a time almost, or a week at a time, a month at a time. You don't know how long it's going to be and what other crises are going to happen. But there was a big crisis eventually, and a hospitalization, a doctor telling me she may not live independently again. And that was the real crisis of an overwhelm. And again, no resources. How can you tell me this and then not prepare me for what's to come? But, again, my background in healthcare was helpful. I had been networking in the community. That was one thing I did to prepare, learn some of the resources, because it could really happen. I just faced the reality that might be our future. And that was why I was here, but also to spend quality time with my mom while we could. And actually her situation, her illness resolved. She did not necessarily need to be in an independent living or a assisted living facility. She regained all of her abilities to care for herself, but it turned out to be a good move, because on and off for the next 11 years, there were a lot of other health issues. It was quite a journey.
Yeah, it is quite a journey, and a lengthy journey. And like you say, one day blends into another day, and all of a sudden you've been doing it for 14 years, caregiving, and you didn't want to call yourself a caregiver, or you didn't recognize you were a caregiver at that point when you started.
Yeah, I don't know. That word just never came up in our family. That, it wasn't really in my vocabulary. But I think eventually, and it may have been a couple of years into that, it kind of clicked in my head. I'm caring for my mom. I'm more than just her daughter, paying attention to her needs. I am caring for her. And that opens up a lot for people when they use the word caregiving and identify as a caregiver, because all of a sudden you realize there's all these resources for caregiver. Well, there are in my community locally, but exploring them when you're in crisis is the hard part. That's part of the preparation. And I did part of that prior to her illness, through networking in the community and learning about services. But when it's really a crisis, it's hard to make a decision. It's hard to find your notes. It's hard to figure out, well, what's my next step from here? And, that's what I love about being a consultant. For people that know I'm here, they've got an instant resource to get issues resolved, to find resources, to have somebody listen to what they're going through and, help them get through it to the next level.
Excellent. And to provide that objectivity that when you're the caregiver, you're subjective, like you're the one that's in it. And so you have a certified caregiving consultant that can help you, and we know the language and we can be very objective.
Exactly. And I think after mom passed away, I sat down and I thought something needs to be done, either about the healthcare system or about referrals, resources in the community. And I thought, what did I need? I could have used someone that had been a caregiver and knew the phases that you go through and knew the resources. And that's what we do. So, that is one thing that's really helpful. And then someone to listen, but a guide as well. What a lot of people say, what did you do in your situation? And we can brainstorm what's best for them.
Oh, definitely. I remember from our first interview that you had mentioned it was difficult to find people who were caregivers when you were in the caregiving role for your mom.
It's so funny because I said that, and then during the time I was taking care of mom, but also mostly afterwards, my friends started telling me, oh, I took care of my mom. It's like, well, where were you?
When I needed you.
Where have you been to help me? And, there were caregivers like myself that came into the assisted living facility to see their family members, their parents typically. And I did talk to them, but I didn't think to use them as a resource, and it was like just a few questions could have opened up my community that was really supportive. And I did ask the director of the assisted living if we could have a family support group or a family meeting, something like that. And it just never happened. So that should change as well.
I love that observation that when you're frequenting the assisted living and you're starting to recognize there's other people that are family caregivers that are frequenting to visit their loved one. Start the dialogue, start the conversation, and then get a little group together where you can have a support group or a supportive team.
Now after caregiving, which has been 6 years since Mom passed away, you have a whole different perspective. I can identify what I could have used, what I needed. I wouldn't have known maybe what to do with a support group situation, how to get the dialogue going. But now I've trained to know how to do that. So learning more prior to going into a caregiving role, just like we plan for our career, we should plan somehow for caregiving. And I do have some invitations to speak to some college age students.
Oh, so fabulous.
I'm excited. Yeah, it's like that's where we need to start. Yeah. And, surprisingly, talking to a few of the universities, one of them out in California has started a department for students that are caregiving for their parents or a loved one. And it's a program. It's a very involved, intensive program. And I think they've done a marvelous job.
Oh, that's wonderful. And kudos to those who recognize that it was necessary. People are bearing so much responsibility if they're going to school and caring for a loved one at the same time. They need supports. Yeah,
somebody recognized that. And, I hope more people do, but that could be a direction that I go in the future.
You have a lot of directions.
I have a lot of
directions. Toni, you do so many things. I know you've just written a book, and let's talk about that right now, actually. Share the title. And
the book is called 21 Mistakes Caregivers Make, Solutions and Strategies for Less Stress and Increased Happiness. The book idea really was my mother's idea, indirectly.
Neat.
When she was in crisis that first time in the hospital, and I got no resources. And, I knew some things to do, but it was like, why aren't you giving me a book? Something extensive to outline some of the issues I'm going to face and the things that I should pay attention to. And I called it 21 Mistakes because I tend to open my emails when something comes through that says 5 mistakes you shouldn't make, that kind of thing.
You like to focus on fixing things.
Yeah. Well, and the whole thing is, we talk about a mistake, but it gives them a solution, an action plan. And there is going to be a workbook that goes along with it. So they can follow the book and go along with it. I mean, the action plan is in the book, but, a workbook to write in is what I envision. The other thing is, not all of these are mistakes I've made, but some of them are. Some of them are the successes I've had, that I knew to do and I knew were important, and that caregivers over time have said, yes, I've done that too. That's important to do. So somebody met a caregiver the other day and she said, only 21 mistakes. And I said, no, I could have come up with more, but I had to stop somewhere and get the book out to help. So they were the things that I felt were most important. Some people have said it's a little overwhelming, and it may be for the first-time caregiver. However, my instructions in the book are find the chapter, find where you are, read that chapter and focus on getting the information you need now and get in action around resolving that issue. So you can jump around and go anywhere in the book toward what you need. But there's really three or four things that I feel are the most important. And one is the relationship that you have with the person you're caring for, usually a loved one. The other is good communication skills, because if you don't have them, you get resistance and you cause upset and you create fighting and arguments. We don't want to go there. We want to avoid going there. And with some people, I know they're stubborn. I hear all the time, my parents are stubborn. And I said, yes, but you can still have a calm conversation about concerns or planning ahead for the future. The other is happiness. I've been talking about happiness for about the last decade. When my first book came out, which was a compilation book called Happiness is a Decision of the Heart. And I really learned if we don't intentionally focus on happiness during the day, anything can happen and it will be disruptive if it's a negative influence. But having your mindset and creating what can we do that'll make us happy today? What can I do for myself that'll make me happy today? Just having that out there and not even exploring it that much, but just putting it out in the world that I'm going to be happy today and I'm going to look at every roadblock as an opportunity to overcome the struggle and to be happy. And there's actually strategies in the book for happiness. So some things that people can focus on. But the key is the relationship. And, if that's a quality relationship and your communication skills are good, then happiness has a better chance of happening. And I guess the fourth thing then is love. And I really learned this from my mom. I was about to explode one day and was tired, probably approaching burnout. And we have a dog, and I brought the dog, a little Maltese, a 7-pound Maltese, white little girl, Jasmine. I brought her all the time to visit mom because I knew it would cheer her up and put her in a good mood. So as we enter her apartment at the assisted living, the dog always runs into her lap, right? She's usually sitting in her lounger chair. And she doesn't even say hello to me, but she's petting the dog and hugging the dog and kissing on the dog. And I thought, wow, I need that. I need what the dog is getting.
Oh.
So to get her attention, I got down on the floor and I crawled over to her on my hands and knees, and I really got her attention. She stopped and she's looking and she's waiting for what's going to happen here. And I got in front of her chair, sat down, and I said, Mommy, please pet me. And she did. She put her hand on my head and she started petting me. But it actually was in that moment of watching her with the dog that I realized maybe loving each other, giving and receiving love was missing from the relationship. And from that day on, we did more hugging, more hand holding, more kissing, whatever felt right to do in the moment. And that act makes such a difference too, because it does stimulate the serotonin in your brain and it does change your mood, and it's all about happy. In a good mood, you can overcome the struggles.
I just want to say that visual lesson that you had when you crawled along the floor, how humbling, but how profound.
Yeah, and that is definitely a chapter in the book.
Oh, yeah.
And I know that not every caregiver loves the person they're taking care of, but also if they can change their belief system or their mind about that person, get to know them, develop a closer relationship, and it's all possible. But it's probably the burden of the caregiver to do that, to take that on. And there's probably a lot of resistance there. But it makes such a difference in the caregiving experience because, as you know, you spend a lot of time with that individual. Instead of thinking it as an interruption in your life and you want to get back to your old life, well, this is your life. This is the present moment. So why not be aware of the opportunities that are available for both of you to have a good quality of life, to have an interesting journey, and to learn something about yourself, which is what I do. I mean, people do tell me, and I experienced it, that I learned a lot about myself because I'd never been in that kind of challenging experience before.
And those are the reflections and the takeaways. And I think you have more takeaways from your caregiving experience.
I do. Well, and what I've learned from my mother is helping me now because I do have an illness called myasthenia gravis, and it's progressing. So I also have a spinal issue that hopefully it will be resolved with a treatment plan, but I need a caregiver on occasion, not always, but I may in the future. So I'm starting to look and, I got disconnected from friends during COVID, from a lot of my good friends. It'll be easy to restore those relationships. And I want to do that. And I need to do that because we need to know the people in our life that would be willing to provide some kind of support. It could be driving to a doctor's appointment. It could be just coming in and doing your laundry, because my laundry's on the second floor. I may not be able to get up there someday. So those are things that I do a special workshop on, to talk about, well, who is it? Because people say, well, I don't have anyone. Well, you do, and you start with the people that are caring for your loved one, but then you have to expand it into people people they know that could be helpers. And it's a job. It's a big task, but it's one that will relieve the most stress. And again, you're building relationships. These can turn into quality relationships for the rest of your life.
And you're taking your own illness, and I'm really sorry to hear about what you're going through health-wise right now, but you're using it to teach others, and you've got an awareness of how to ask for help, how to accept help, how to seek resources for yourself that will be useful in taking care of your own healthcare needs. And like you say, you've got a workshop, so that's fabulous. But I'm, again, very sorry that you're going through this.
Thank you. Well, there's a lesson here, and I'm reading my book again so that I do the right thing, because I've got it all figured out.
Yeah, having that team of support and knowing who to ask. And if you ask someone and you know that they're not the right person, that's okay. Just go on to the next person, right? Like, you just keep asking.
Yeah, well, one of the mistakes in the book is not asking for help. And people have a lot of reasons that they do that. And there's even an appendix with how to ask for help. Most people are wanting to hear a yes when they ask someone for help, because we're very in need of that support, and we think that's the right person to do it. So when we get a no, or I'm busy that day, or I can't do it, it sounds like a rejection. I mean, we need to respect that people have busy lives too, and they have their priorities. But asking someone for help and getting a no the first time doesn't mean you shouldn't ask again. Also, certain people would have more fun if they would do something like driving you to an appointment rather than going to the grocery store for you. But somebody else is going to the grocery store. What can I get for you? Give me your list. So we've got to find people's strengths and what they would be interested in helping with, because that's when their joy shows. And that's where you can get the support you need.
And that's a win-win.
Yeah, it's a win-win. It really is.
Mm-hmm. Yeah, 21 mistakes.
You're wondering what they are.
And the solutions. Yeah, I haven't seen them. Well, I have seen your work before, but not in the book form.
Right.
Not yet, but I'm excited to.
Thank you.
Your caregiving journey with your mom has concluded. And what are your best takeaways from that caregiving journey, other than the 21 mistakes that you now have written
Just a few
into a
things,
book form?
right? I had never cared for anyone before. I thought, maybe someone with the flu or something easy that resolved. So this was a long-term commitment. And one of the takeaways was just, first, how rich the experience could be and was with my mother when I put attention on getting to know her life in a whole different way than I viewed it as her daughter. And, being absent from her and my father for a long time, because going about my own business and having my own life. So asking questions and being curious. Mom loved to tell stories about her life. I just had to come up with the questions. And I did. I came up with about 400 questions for her. It was like, and some of them didn't mean anything. It didn't trigger a memory, but we went through the list, and she got so excited when there was something she could talk to me about. So I learned about her childhood, learned about growing up in Chicago, her taking music lessons, and I learned how she met my dad. That was such a joyful story to learn. So, what was possible? That's a different relationship. I always got along well with my mother. We had a close relationship. I'm an only child. We were there for each other, but the conversations got different. And her perspective about her life, she was in a completely different place. And my dad had died a couple of decades earlier. And she got through that. And that was interesting, to hear her tell me how she survived that and thrived later on through it. The other thing I learned, I could rise to the occasion. I never thought of myself as a problem solver before. And that's what caregiving looks like a lot of the time. What treatment do we take? Where do you want to live? And now a lot of these things happen for me when I could communicate easily with mom. And some of the preparation helped in knowing what her needs and desires were. When she left the hospital and the rehab center, I could not have had these conversations with her, but she eventually did recover. And it was a simple decision that I made to ask the doctor to change her medication. And the medication was really causing her to, well, I don't know what the word is. She was distanced from reality. She was not aware of things going on, and it was morphine. And I don't like morphine. And she didn't need it at the time. So I also learned to question doctors and not to stand down when they say, no, everything's fine. Right. We're doing the right thing. And that comes up a lot with the physicians, finding physicians you trust and that have followed you over a period of time is so helpful. And I'm learning that too with myself. I've been in this community again for 20 years. I've moved back and forth from Orlando over time. And the people that know my healthcare needs and know my history are just so critical to my team and to figuring out what's going on now and what I need. So yeah, that's kind of a summary of the important things.
Totally. And back to when your initial call from your mom, like the doctor saying, there's nothing we can do. You didn't stand down then, and you had to see for yourself that that was what he was saying. And you did see that. But yes, now to develop that rich team that you have that knows you and knows your health concerns, and you trust them and you believe in them.
Mm-hmm. Since I know myself as a caregiver, I've researched my community resources, and people know people, and you never know who they know that can help you. And that's one of the things why you need to ask for help, because the person you're asking may not know, but the next person you ask may say, oh, yes, you need to go see this person.
Right. Or the person who doesn't know might know somebody
might
who
have
does know.
Or has a referral.
Yeah.
Yeah. And, these are conversations people aren't used to having. So, you may not get an immediate result, or you may get, oh, I'll have to think about that, but that's okay too. What we want to do is bring as many people onto our team, onto our care community as possible, and educate them, because they may be in a situation where they need help at some point, and now they have a resource. They can know you as a resource. I've had to learn to ask for help, so I'm still practicing. Well, it's one of those things that it's just not a normal thing for us to do, and that we've been told so many reasons not to, or that it makes us seem weak, or whatever the conversation is. We've got to get all those beliefs out of our head, because when you find someone that does want to help, you realize that it's human nature, that people really do want to help each other, and they do want support as well. You're
right. We are socialized to be self-sufficient. But you're also right that folks want to help, and they do. Like, it satisfies a need if you can be that person that steps up and really is helpful.
Exactly.
But you talk about resources, and you are a resource, and you've got many platforms. Would you like to share about the dementia-friendly cruises?
Okay. Well, this is a fun story, because the very first presentation I gave, I met a man named Dennis, and he came to 2 of the 3 presentations. And at the end of the 3rd one, he said, you need to be in touch with Kathy at a Light Cruises and Vacations Travel. And I said, okay, sounds interesting. I'd love to. And he said, I took my wife on a dementia-friendly cruise. They have a support team for their guests, which are the caregiver and the person they're caring for, and any family members that want to come along and experience, a memory, make memories with their family member. So it's supported by nursing staff. It's supported by a staff such as myself and anyone that is creating the program, because we do a conference on the C days and we go to interesting places, but we're there also to take them to excursions. And we do this on, Kathy is connected with Holland America Cruise Line. So we use their cruise line because they know us. And she's been doing this for about 6 or 7 years now. And they understand how to really take good care of us. I mean, they're a cruise line, they're taking care of people all the time, but they understand we have some special needs. So yeah, we get to do our conferences. I get to spend at least a week or 10 days with the families. We do support groups and we have fun. And people cry.
Yeah.
Because they're finally being understood and they're finally having some good experiences, and they may be struggling with decisions at home because they come with in different stages, different abilities that their loved one can do. We usually do the one to the Panama Canal, and that's October. It's a 10-day trip. So there's lots of opportunities to create memories, to have fun. We usually have singing, and in addition to our support groups and our conferences, we do a lot of engagement activities. So people really think they're on vacation and they need a vacation. And we have separate activities for the individual that they're caring for at certain times of the day. So it gives them some respite time. Yeah, it's been amazing. I think I started doing this in 2019. We had COVID, didn't we?
Yeah, we did.
So there was a break in the action, and we've gone to the Caribbean with some of the folks. Some of them are West Coast, and there's a trip to Alaska too. So there are places you want to go if you haven't been there, and where you really can create fond memories.
So I just want to share that I've had Kathy Schoaf on the podcast in the episode called The Happiness Crusade, speaking of happiness.
Mm-hmm.
And it's not just for folks who have dementia, it's for other chronic illnesses as well. So definitely worth checking out Elite Cruises if you want to go on a vacation with your loved one and yet have a vacation while you're there.
Exactly. And if they need wheelchairs, those can be provided. Any extra accessories to make them comfortable in the room. Kathy does all of that.
Yeah.
So it's really, and the caregiver doesn't have to do it all themselves.
Yeah, sounds wonderful.
Right.
And so other dementia-friendly activities that you're involved in, do you want to share the dementia-friendly dining?
Yeah, this has been an interesting project. I serve on the state of Florida Dementia Care and Cure Initiative, and that's where it came out of working together with many people involved in dementia care to pick projects, select projects. One of them was to train businesses to be what we call dementia friendly. And my partner got the idea from his son to approach the restaurants and find a restaurant that had a back room or a quiet time when they were not busy, and approach them about becoming dementia friendly. Now, that means we train their staff. They allow us to come back in when new staff comes on, so everybody is trained. And it's about a 30-minute to an hour training, so it's not intensive. But we have to find the right restaurant, and they have to agree to certain things. But the biggest thing is it's a slow time, it's quiet, people can come in and have some privacy. They can promote that they're a dementia-friendly business. And we've started it out by bringing a lot of our friends who were caring for spouses with dementia, who were looking for an outing, a place to create a memory. And we've got some pictures of those people. And we also send out press releases locally so that the media knows what we're doing. And we have been interviewed on TV shows and radio podcasts and radio shows as well, and in print magazines. So we're teaching the community that this is possible, and to learn about dementia, which, and people say, well, it would be good for my son with autism. Well, go with the times, because they'll welcome you. It would be good for a lot of people. The focus was on dementia because that was the organization we're working within to make it a dementia-friendly community. It's fun to go in and train people. Yeah. They're already enjoying their jobs as servers and receptionists there, and the managers are usually they have some connection to a family member, or the staff does. So we learn about, their history as well. But they get excited because it's something different. And now they're trained, they have a new skill,
Mm.
and they get very excited about welcoming people into the restaurant.
And so this started in Florida and it needs to spread across the nations.
Well, we think so.
Yeah.
I mean, we'd like to see every community become dementia friendly. This is something people need to learn about. Even with my healthcare background, I did not know anything about dementia. I was like the typical person that thought it was a memory loss issue, and it's so much more, and it's so devastating to the families. And whatever we can do to help these families in their life and create the memories that they can treasure. We've trained some people in the Tampa area. There are some restaurants now in Tampa, and we've gotten calls from other states. So this is not something we do for money. This is something we do as a passion project, and just know that it's needed. We want to transform our communities. Where there's also Orlando is a senior friendly community. I think that's the word they use, or, they've signed up to do things for seniors to make the parks more accessible, transportation more accessible. So it's really aligned with current thinking on just making it a friendlier community. And who wouldn't want that, especially today with everything going on?
Yeah. And as we age, we want people to be friendly towards us.
I do. And as I go out in the world with my walker, I want people to help me and not be afraid to come talk to me and
Yeah,
offer
for sure.
assistance. Yeah.
Yeah.
One of the things I learned about caregiving, my mother did not have dementia, but she had one health issue after another. We were in the emergency room quite often. There was always something to put my attention on. There were appointments to make. I don't even know how many doctors she had. She had a neurologist, she had a cancer doc, an oncologist, she had, a list, and I had to manage all of that, all of her appointments and her follow-up appointments. So caregiving looks like a big to-do list, and it is primarily that. Or we think we need to put our focus on the task, and we do. But I noticed what I did was put my focus so much on taking care of her, because that's what I was supposed to do, that I just forgot about being her daughter. How can I just have a normal relationship with my mother? And I thought having her reside in an assisted living facility would solve that.
Mm.
And then, I realized they don't do everything. They don't provide 24/7 care. It's like, oh no, you have to hire somebody to do that, or you have to be here. They're not that available. So that's the learning curve. As you go through, you learn about hospitals and doctors, and you learn about the different facilities and what they do care for and what they don't care for. So the relationship is, I can't stress this enough. And I've seen some very loving relationships, especially on the cruises, the way they take care of people and, offer love, give and receive love, and look for the joy and celebration in life despite what they're going through. It's beautiful. And I would hate for people to miss that experience. And I know some people work, some people have children at home, and some people are caring for an adult. So how do you manage all that? Well, I don't have a general answer, but I know focusing on the relationship and love and happiness is a critical part, and just having that quiet time. But you also have to take care of yourself. And this was my biggest challenge. It really was. I didn't have very good routines before my mom got sick. I didn't have very good eating habits before mom got sick. And it's like, now how do you figure that out? Well, you don't. You get that in order ahead of time, or you do one small thing every day. There's a coaching program, and they tell you, well, what's 1% more that you could do tomorrow to take care of yourself? Just 1%, and look at every day. What's 1% more that you could do either for your loved one or for yourself? And that kind of breaks it down into a manageable chunk. Well, I could stop snacking, or I could eat different foods if I'm going to snack, something like that, or have that water handy so that you can consume enough water, for it to be healthy.
Yeah. So self-care often gets neglected, doesn't it?
It does because it looks like a big project.
Mm.
And it is overall a big project to maintain weight, to maintain your health. But the other thing that happens too, and this happened to me as well, is that you put off going to the doctor for your needs. It's like, well, no, that's not where the priority is. Well, yes, that is. And in my case, it was for a knee replacement surgery. And it sure would have helped getting those wheelchairs into the back of the car if
Mm.
I had done it sooner, right? I wasn't in a lot of pain, but it was there. What I needed to do was to try to figure out, though, because of the rehab session that's so long, it takes about 6 weeks really to get back on your feet. I had to figure out a plan to take care of mom. And she was in assisted living, so a lot was taken care of, but that community, that care community again, becomes really important. And so once I managed having people in place to care for her, then everything worked out just fine. And one of my friends even picked her up and brought her to the hospital right after my surgery to show her she's okay because she was worried.
Oh,
And that was actually something I didn't even think to ask for. Can you bring
yeah.
my mom? I didn't
Oh,
even ask for that. But that individual saw that that would be very important to my mother. So
yeah.
yeah, your friends think of things you don't think of. That's the other thing too. We're pretty good by ourselves to come up with solutions and ideas, but when you get two people together or three people together figuring things out, there's so many more options that come up. So I'd encourage people to get with a friend who's been a caregiver, who understands the situation, or who hasn't been a caregiver. There's still good people that have great ideas. Just explain your situation, your circumstances, and what you're trying to accomplish. And people do really show up.
Yeah. So welcome those ideas.
Welcome the ideas. You don't have to use all of them. You can say, thank you, I'll consider that. Thank you for offering to do XYZ. Let me think about that and I'll let you know my plan when we get it in place.
Mm. So self-care for you, Toni, meant that you had to get a plan in place to care for your mother or to have your mother's care continue while you were able to plan for your own care, your own health needs. That's pretty onerous.
Yeah. When you become the care recipient as well as the caregiver now, you know, I managed it, it worked, and we got through it. And, it was a good experience for my mother too, to have other people helping her
Mhm.
because she relied on me a lot. And it was always me. Well, I want you to come. I want you to do this. I need you here. I want to see your face. You're my daughter. I love you. I said, I know, Mom. I love you too. But let's include some people. And, it'll be fun for you as well. And so she finally understood that, having gone through the experience. And that was helpful for the rest of the time I was caring for her.
And it gave you an opportunity to let go as well.
Yeah. I could still manage from afar,
Mm.
manage the people, schedule things. And it was a relief to have the time to recover and get healthy again. And, it was a whole new experience for mom, letting other people in. She was a little stubborn about other people helping her. So we had to overcome that.
These are great insights, Toni. Thanks for sharing. We have time for one more. Do you have something that you'd like to share? Another story about your mom, perhaps?
Yeah. My mom had some issues with her feet, and we wound up at a very nice doctor's office, with a nice doctor who we really liked, was very compassionate and had a good bedside manner. So I took her there many, many times over the 14 years that I was caring for her. And I also had some foot problems. So I started going to see the same doctor. And when I left one of the appointments, I noticed a business card kind of tucked away on a counter, and it was for an individual that was a certified caregiving consultant.
Oh,
And I looked at the card and I picked it up and I said, who is this? He had never thought to refer me to this individual.
hmm.
And she happened to have been a patient of his. And that's how, he knew about what she did. but he never said anything to me all those years.
Wow.
And I thought that was the person that could have helped me
Yeah.
and been my guide through this journey.
Yeah.
So I looked into the program, and that's how I became a certified caregiving consultant. It was the same program with Denise Brown.
Wow. That's quite the testimony. I hope you took a stack of your business cards and left them with him and suggested he give them out.
I planned to do that, and I planned to see if he would be interested in buying some books
Yeah.
for his patients. I mean, that would even be great. I really think the physicians need more resource material.
Yeah.
You know, they really just leave you with recommendations and often a plan, but you've still got to figure it out. There's still work that the caregiver or the patient has to do to figure out exactly how to manage the situation. That's my story to doctors.
Excellent.
Pump them with questions. Be curious, ask questions, prepare ahead of time, and find out what they know about resources. And I never asked a question about resources. He'd always ask me how I was, but didn't get the resources.
That's a great tip to take away, is ask for resources.
Yeah.
Great idea.
Yeah, thank you. I've probably said this, maybe I'll say it in a different way, but I do look at all of our challenges in life as perhaps the best opportunities for us to grow as humans. And I really think that's why we're here, to give love and to, find out what does it mean to reach our potential or to expand ourselves where we haven't done that before. You can't avoid new challenges because you have a new job and then you change jobs. There's new challenges. And I always was a little nervous about change and about accepting a bigger challenge because you wonder, can I do this? What did they see in me that they thought I would be a good employee for them? So it really is a time for self-reflection.
Yeah.
Everything that happens. And I really started using the happiness principles that I talk about. I was kind and generous to everyone that I met, no matter what kind of crisis we were in. People respond to that kind of attention, and they may do more for you when you treat them well. So every opportunity, I mean, even in the hospital, to meet someone new, to, when there was time, find out, why are you a nurse? What do you love about your job? To establish just relationships, and to also find out, can you meet the demands of caregiving? And probably not everybody can, but I think that what's preventing them from doing that is, maybe their belief system that this is not my choice, so I'm not going to pour myself into it. But as you found out, I pour myself 100% into all of my projects, and caregiving was not my choice. But, and it helped that I had a good relationship with my mother. But I thought, gee, how can we make this day a really good day? And before she got sick, I was helping her a little. We went to doctor's appointments and made sure her medication was taken properly and little things. But I really got to know her. We went shopping, we went out to restaurants, we just spent time reacquainting ourselves. And she did not know all that much about my life, the details of it. So I think she really enjoyed that too.
And that leads me to ask you if you wouldn't mind sharing one tidbit about your life with me and the listeners.
Yeah. You'll never believe this. I'm going to say it anyway, but I was shy as a youngster and a teenager and a young adult. And I knew that was something I had to overcome. And I realized, people are interesting. I was a good listener though, because I was shy. I wasn't a talker. So I learned to ask people questions about themselves. That's where those 400 questions came up with my mother.
I remember from our first podcast episode together called And Then I Danced that you took up ballroom dancing later in life.
Mm-hmm.
Let's talk a little bit more about that, especially now that I know you were shy when you were a youngster.
Okay. As I mentioned, Mom had a series of illnesses. We always seemed to be in the emergency room, and I always seemed to be needed to be there with her. to make her feel safe and secure. Well, there was a time after an illness where she recovered and things seemed to be going well. She was very active at the assisted living. They had plenty of activities that she engaged in, and the activities director encouraged her to get out of the room and be busy. So I approached her about it was a dream or a bucket list item that I had, and that was ballroom dancing. And I said to her, Mom, I would love to take some lessons and it'll relieve some of the stress that I've been under, and maybe you can enjoy it with me. So I did. She just lit up and said, your dad and I took some lessons, and I did know that because I saw him dance. I would love for you to go do that. So I started taking lessons. I was 57 at the time. I felt like, boy, this is kind of old to get started, but let's see the result. And I was able to continue for over a year till Mom had her next crisis. But the result of that was I became a competitor, ballroom dance competitor. I also danced at several charity events, and I also entertained at Mom's assisted living facility on special holidays. And if I didn't have a partner present, I just engaged with the residents and got them involved in dancing, because there was music a lot, because that's so, makes you feel good and get you engaged. But it needed a person to get people to stand up and get involved. But they started to know me as the dancer. When are you coming back? When are you dancing for us? So, it served me from that time on. When you take lessons, it becomes part of your life and you call yourself a dancer, and I'm a dancer. I'm going to get back to that soon.
Wonderful.
But it brought so much joy to my mother, and she was able to watch my first competition and see me get an award. So it was just delightful. I just didn't realize the future benefits that it was going to have, but I really enjoyed it. Will always enjoy it. And now at 73, I'm looking for my next partner.
Oh my. Well done. Well done.
Yeah, thank you.
Yeah, that's fabulous. As is this discussion and conversation and the information that you're sharing and the encouragement that you're providing. I just thank you so much, Toni.
Oh, you're very welcome. This is what I do. This is what brings me joy.
Oh, I'm glad. Toni, before we conclude, how can folks reach you?
Well, they can contact me through my website. That's probably the best place. And that is www.mycaregiverconsultant.com. They can also have access on the website to a free guidebook. And it was the preliminary to the book that I wrote. There is a downloadable book called 21 Mistakes Caregivers Make. So please come in to the website so that you can get an overview of things you should be looking at this point. You can call me or contact me through the website for a free consultation. Be glad to review any of the areas that are challenging you. And my book will be out in September. So get on my mailing list and you can be the first to buy the book. And it'll be available on Amazon.
Perfect. And are you on any other social media platforms?
I am on LinkedIn, and I'm starting a Facebook group called Heart of Caregiving.
Okay.
And so there will be a group forming there. I have a social media consultant, though, that's managing that because I don't know how to do all that.
I'm jealous. That's good. That's time saving.
Yeah. So I am on Instagram and Twitter, but I'm not active on it yet. But you can find me different places.
Perfect. All the best with your book launch in September. Very exciting.
Oh, thank you.
Thanks, Toni. When caregiving, Toni knew she needed some help. She wanted resources and guidance. Her own doctor held information in the form of a patient's business card that could have helped Toni earlier on in her caregiving journey, but he hadn't offered it to her. This was frustrating, but Toni asked questions about the card she saw on his desk, and she found a resource she needed. And that led her to become a certified caregiving consultant to now help other caregivers to prepare for and navigate through their own caregiving journeys. And she doesn't stop there. She has taken on passion projects such as bringing dementia-friendly dining to her community and presenting her wealth of information to guests on the dementia-friendly cruises through Elite Cruises and Vacations Travel. Toni shared how she finds herself facing a new life chapter, that of needing a caregiver herself on occasion. So she is again utilizing helpful resources, including reading her own book. Now that's a great endorsement. Talk about rising to the occasion of caregiving. How about you? Are you in the midst of a caregiving journey in need of supports? If so, I invite you to tap into alongside caregiverconsulting.ca or Toni Gitles' website, mycaregiverconsultant.com. Thank you for tuning in today, and to Toni Gitles for sharing your caregiving story, your resources, insights, and the importance of relationship, communication, happiness, and love to help us all rise to the occasion when caregiving. If you don't want to miss future episodes, be sure to subscribe to the Island Treasures podcast and feel free to leave a rating and a review. See you next episode.
This is the Whole Care Network. Helping you tell your story one podcast at a time.